Did the iron treatment give your energy levels a boost?
Oh, did it?
I first met Dolores in 2012, and she presented, as many other people do, to come in to manage her chronic conditions. For her, that was diabetes. What have your sugars been this week? Dolores' sugars were averaging probably in the high 200s, low 300s.
I could always tell when it was high. I would be so tired. Then I couldn't get a lot of sleep because my sugar's so high. I'm going to the bathroom, it seemed like, almost like every 5 or 10 minutes.
I think I saw her about every 3 months, and often she would say, I think it's getting better, and then the tests would say otherwise. So we were kind of at a loss.
I had to go into the emergency room because, well, a couple of times I couldn't see that well. And I got scared. And I went 2 more times. It was sugar related that I had to go.
As we work on your diet and your exercise.
Eventually I was able to engage our care manager, Eileen.
When I first met Eileen, she was asking me about, telling me about how we're gonna work on my blood sugars. And she was really on me about it. So I said, I don't wanna work with her.
It took me almost a year to break through to Dolores before Dolores actually was ready to work on her diabetes and taking her medications.
The first suggestion was take your insulin in the mornings, because at night I would forget to take my insulin and I would fall asleep, and it worked. I could work with that. It was so much easier for me.
And since we did that, she has not missed 1 dose of her medications.
My high blood pressure pills, I wouldn't take those every day. Eileen scared me to death. She said, you don't want to have a stroke. You don't want to have a heart attack from this, do you?
I know Dr. Dent told you that your blood work was much better.
Dolores has a lot of barriers to her care. At the time I met her, she was having problems affording her medications. So our social worker hooked her up with financial assistance. Dolores needed some help with housing. She was being evicted and was going to be homeless. So our social worker worked with her closely to help her find a place to live.
Our care manager's extra time with her really was able to kind of uncover some of the barriers which were beyond what I knew with her, some of the things that she was struggling with that I didn't capture in a medical visit.
She needed the support of our whole team, our social worker, our certified diabetic educator, the nurses that work here in the office when there's a problem with their med refill. Dr. Dent and I engaged her with our certified diabetic educator, Cassie, and Cassie worked with her on her diet and exercise.
With my food, the portions, just eating just vegetables, that's kind of new to me because I'm a meat eater. I would literally fill this bowl up with ice cream. I was telling her I just love ice cream. And she said you could portion it out. And this is the size I eat now.
Dolores wasn't getting any exercise at all. And now she's walking on a regular basis, working on her diet, her exercise, her faith. That all has brought it together for Dolores to be able to be a controlled diabetic now.
When she started saying, oh, Dolores, I'm so proud of you. I'm so happy. Listen, look at your blood sugars. And for me to know that I was making progress, then it made me feel like I could do this.
And she'll call me before she gets in dire straits. And we're able to avoid the emergency room visit, a hospitalization, because of our good communication.
Thank God I haven't been back in there in emergency for anything.
As a team, we're here for you in the future for anything that you need.
We couldn't have made this progress with the traditional doctor's visit that's 15 minutes. The progress really was building trust, and that's really key to patients in our practice.
When Eileen would call me and just check on me, I just felt that somebody cared. And she was looking out for my best interest, so it just gives me a different outlook on things now, and especially with my health.
Your 14-day average is 118. Your 14-day average was in the 300s and 400s when we started.
Dolores' most recent hemoglobin A1C demonstrates that she is at optimal goal for her diabetes, which is a phenomenal result, and one that we are proud of, but more importantly, that she is very proud of.
Well, I feel great about how my health is now compared to, compared to the way it was.
It's really rewarding to go home at the end of the day and know that you've made a difference in a patient's life.
Totally different place. I really am. I really am. And I feel so much better.
I could not have gotten into the same depth of the barriers that Dolores had without my care manager. Currently, we're in a transition time where we are still being reimbursed on churning in patients in and out of rooms, but really we're knowing and we're starting to see that the better care is this team-based care, often when the patient is not in the building, is sitting and planning, outreach by phone, and that's the direction and the model that I think is exciting in the future. We're a little bit caught in the middle now, so physicians are struggling a little bit right now because of being asked to kind of do both, but eventually I think it's exciting.